Now, let's look at my ego-free solution to male infertility. Why ego-free? Well, the fact is that fertility and sperm quality is often a touchy subject with men. So let me begin by stating that your sperm quality and quantity has nothing to do with how manly you are. Because sperm is such a crucial part of conception, every man trying to conceive should take the quality of their sperm very seriously. With just a few simple steps and basic changes, any man can greatly improve the quality of his sperm and as such, their chances of getting pregnant with a partner. Low sperm count is a common medical symptom affecting men, and it happens when there is less than 20 million spermatozoa per milliliter of ejaculate. What most people don't know is the fact that more than 40% of infertility is actually caused by men. But how can men be infertile? It's all simple mathematics, really. Or in this case, it's actually related to the male sperm count. A normal, healthy sperm count is important because this can be the key that you need to conceive in a healthy and mutually satisfying sexual life. As I just mentioned, with as many as 40% of infertile couples, the cause of infertility is actually due to a factor involving the male partner. Male infertility may be caused by a number of factors, including problems associated with sperm production, sperm transport, and sperm motility, as well as anatomical problems, blockage in the vas deferens. Now, this is the tube that brings the sperm from the testicle to the urethra and infection. These same factors might also cause a lower motility. Motility is determined by the percentage of sperm that are moving or swimming. Often infertile men become obsessed with their sperm here, causing further anxiety in their lives. In reality, the real question a male with a fertility problem should be asking is not, what is my sperm count or motility? Instead, it should be, is my sperm capable of working or not? Can I make a baby with my sperm? Since the sole function of the sperm is to fertilize the egg, the only real way of answering this question is by actually testing for male fertilization. No one really knows what a normal sperm count really is. Since you only need one good sperm to fertilize an egg, there isn't a simple answer to this question. Clearly, most men usually don't know that they have a problem until they're trying to father a child. The absence of sperm means no babies. Therefore, the less sperm produced, the fewer chances you have of impregnating a woman. Each time a man ejaculates, there are around 200 million sperm released. With such a large number, the odds are good for just one egg to be fertilized. Within a few hours, these 200 million sperm will have dwindled to around 100 million, which means their job will be far more difficult. Keeping in mind also that the journey the sperm has to endure to reach the egg is long and difficult. The sperm first needs to know in what direction to swim, and science has shown that almost half go in the wrong direction. So the woman's body will also kill off thousands along the way as a defense mechanism. The major causes of low sperm count include the following: stress, emotional stress, and other psychological issues can lead to low sperm count. Heat exposure, hot baths, saunas, high work temperatures, tight clothing, or clothing that doesn't breathe like nylon, mobile phones in the pocket, even using laptops on your lap. Fever also causes testicular overheating, which leads to lower sperm count and quality. Bathing in a hot water tub, this heat can cause a decrease in sperm production. Body weight, being overweight, can cause your fat tissues to overwhelm your testicles. This can have the same effect as the hot tub because the increased heat can reduce your sperm production. Not enough zinc in your system. Having good zinc levels boosts your sperm production. If you want to increase your sperm count, you can try adding meat, shellfish, legumes, seeds, nuts, dairy, eggs, whole grains, fruits and vegetables, and dark chocolate. These are the 10 best foods that are high in zinc. Cycling. Exercises such as cycling can raise scrotal temperature and also cause genital numbness. Alcohol abuse, excessive alcohol abuse absolutely lowers fertility. Smoking or chewing tobacco can cause abnormal sperm morphology. It can also damage the sperm's DNA and cause fetal defects. Lubricants. The use of lubricants during intercourse can affect sperm motility. Recreational drugs, such as marijuana, ecstasy, or methamphetamine, which is also known as ice, cocaine, opium, can all adversely affect sperm count and quality. Other major causes include infected semen, malformed genitals, overexerting the body physically and mentally, prostate gland infections, exposure to toxic pollutants, bad eating habits, eating fast, and over-processed foods. There are quite a number of factors that cause low sperm motility. This condition not only deprives a male the ability of getting a woman pregnant, but it also robs a male's sense of self-esteem and can easily lead to frustration. So, nutrition matters. There are certain vitamins and minerals that can lead to sperm motility if taken correctly. Medication. Certain medication negatively reduces sperm count. Some of these drugs include antifungal and antibiotic medications, some also medications, antidepressants, and steroids, among other medications. Therefore, it is advisable that you get all the necessary checkups before you undertake certain medication. Long hours of driving. Extended hours of driving are very harmful to the development of sperm. This is because the friction that arises in the process of driving. This will therefore have a negative effect on the sperm count. Other common causes are mountain biking and cycling. This is because they can cause shock to the scrotum and testicles, which reduce the possibility of the sperm reaching the egg. The inability of a male to provide his partner with a child can be a bruise to his ego and self-confidence. It may also take a toll on his relationship with his partner. This may seem daunting to many men. However, in this modern era, there are many effective remedies available. Before finding a treatment for low sperm count or male infertility, it's necessary to fully understand the 5 leading reasons for these fertility issues. Number 1, erectile dysfunction. This is a problem that is faced by a lot of men. ED is characterized by the inability to obtain or keep an erection. Number 2, blockage of sperm. In order for a male to impregnate a female, the male must successfully produce sperm cells. Number 3, hormonal abnormalities or genetic disorders. Male infertility may also be due to specific genetic disorders and abnormalities with the normal production of male hormones. Number 4, infections, infertility, or the inability to produce enough sperm may be caused by infections. Number 5, incapacity to produce or release sperm. When you fail to produce enough amounts of sperm, this is called azoospermia. In my pregnancy accelerator coaching program with my fertility patients, I delve into extensive detail on all male infertility issues and show my patients how the majority of these issues can all be easily reversed. For now, just keeping the following goal in mind. A fertile man has a sperm count greater than 20 million per mil and motility of greater than 40%. A male infertility test that is carried out at the direction of a medical professional will also look at sperm appearance and other factors such as the presence of white blood cells in the semen. Testosterone is what helps you develop quality sperm. Although testosterone specifically doesn't make sperm, it plays a key role in its production. A decrease in testosterone can lead to a decrease in libido and overall sperm quality. As mentioned earlier, nutrients such as zinc and selenium are vital to help produce quality sperm as well. Exercise. Regular exercise can help you shed excess weight and boost sperm count. A regular exercise routine will work wonders for your sperm. If you're able to do so, try to have intercourse in the mornings. Why should you do that? Because, first of all, male testosterone is at its highest level very early in the morning, and that's also when your sperm count is at its highest. Good sex equals making babies. It may seem obvious, but too many couples who are having difficulty initiating a pregnancy forget the most important rule to conceiving a child is to have sex. More than half of all the couples trying to have a baby have sex less than once a week. Your libido can take a hit from a lot of things, including age, health, and the stress of trying to overcome fertility issues. But the fact remains, making love equals making babies. The less sex you're having, the less chance you have of conceiving. For many couples, sex is something of an exploding passion. Softer, deeper intercourse that lasts 30 minutes or more can make it easier to conceive by allowing the couples to experience true love and intimacy, which are really important ingredients for making a baby.